So my name is Sergey, and the theme of my presentation is optimization of healthcare system from the cancer patient point of view. So what is this problem really want? You can see brief statistic on the slide in the world and in Europe. The next slide show us the relevance of the problem of cancer in Ukraine. Ukraine stayed on the second place in the mortality structure. So, and the second place in Europe. What is the goal of my work? There is an identifying areas of optimization the healthcare system form and the perspective of cancer patients. So on this slide are objectives of my study. So research methods. You can see here research information base we used. So on this slide, and strategic documents which we used. So what is the there is a reduce by 1/3 the rate of mortality from non-communicable diseases through prevention and treatment. So here you can see action plan for NCD prevention and control of the cancer. So here is the dynamics of cancer population of Ukraine. Here we can see that from 97 to 2017, the dynamic of the cancer is increased. So here we can see the dynamic of the prevalence of cancer. It's also increased, and here ranking of areas by levels of cancer. So you can see on this slide. Okay, there is a specification of cancer morbidity between sexes. So and population mortality from oncological disease. Okay, here you can see population mortality from oncological diseases in the Europe and countries WHO. So decrease in tempo of mortality from cancer. We can see Ukraine and EU countries. So here we can see the structure of diagnosis oncological disease by stages in Ukraine. So we can see that 52% are the second and first stages, and 17% in the third stages. So, okay. Analysis of the State Statistics Service of Ukraine did show a significant differentiation in the levels of income of citizens. Thus, the total income of the wealthiest 10% of population in 2018 is 4.7 times higher than the income of 10% of the poorest people. In urban areas, the income is 4.8 times higher, while in rural areas is 4.2. So here we can see the unsatisfied medical needs of the population. So on this slide, and here unsatisfied medical needs of the population. there was a significant difference in dissatisfaction with the purchase of medical supplies among the first and 10 decline population group. So 21 and 16% respectively, and 32 and 27% of the least affluent population, and couldn't not visit the dentist. So the 24% in the first group and 10 group wouldn't make prosthetic. And 52 and 33% couldn't not receive hospital treatment. So the next one is the patient's assessment of the oncological profile. So survey results show that cancer patients are predominantly low-income people. Most of them rate their living conditions on a 10-point scale with a score of 5, so 52%. And patient rated their health status as bad. There is 4 points, 12%, 3 points, 47%, and 2 points. So the next one, which healthcare system is the best? So 72% of citizens think that state's system, healthcare system is the best, and 27 think that private. So here we can see the satisfaction with the healthcare system. So 25% completely dissatisfaction. So 43% low satisfaction, and 19% practical satisfaction, 4 to 5 points. So okay, in mild health disorders, 72% of respondents refer to the primary care and physical and municipal health facility, and only 2.8 preferred a private physical. So expectation from the doctors were effective treatment, 89%, prescription of the drugs, 68%, and appropriate of painkillers, 64%. This point is the most important in the patient who go to doctor. So what characteristic which the doctor should have? So that's of course high qualification, willingness to sympathize, and ability to communication and inform. So here we can see fear of the patient when appealing to the healthcare system. So the next slide shows us the patient vision of the healthcare system. So we can see it. And sociological surveys of patient of Health Institute of Oncological Profile. So calculation, we can see it on this slide. And so that's all. Thank you.
We have our colleague slightly more time, but it's okay. So if you have some questions, please be active.
Yes, ma'am, I have.
Remember that we have a poll, and that is why your questions may influence on the general score.
Ma'am, I have a question.
So
I have one question, ma'am. Hello. Ma'am, I have one question.
Анна Вікторівна, у вас вимкнутий мікрофон.
Yes.
Ma'am, I have
So-
one question.
So you make like a continue.
Hello, bro. Can you tell me, when you did the sociological survey, how many persons did you respond to it, or was it just an what can we say? Was it just an assumption? Did you conduct any survey regarding the oncological treatment process, or was it just an assumption which you made?
We have some more profile to the this study, and so
Can I ask a question too, please? Can I ask a question?
yeah.
Okay. So your presentation and topic of study was great. I enjoyed it. Thanks for it. But I wanted to know something though. What's Chowdhury? Just a continuation of what Chowdhury said. I wanted to know your main focus. You mentioned something about oncology, which is a big topic. You also mentioned something about communication, healthcare system. I want to ask you: do you think there is a relationship between lifestyle of people, both elderly and young, and the epidemiology of cancer in the population?
I don't hear you. Can you repeat, please?
Yes, sure. I mean, do you think that there is a relationship between the lifestyle of people, a health habit to be specific, example, alcohol consumption, smoking, and food consumption, because some foods, processed food, are carcinogenic too. Do you think there are relationships between all these foods and general lifestyle of people, both old and young, to the rate of oncology, the epidemiology?
Yeah, of course. So our lifestyle make the epidemiology of the cancer disorders. So I think that the people who really smoke and eat junk food really increase their risk of cancer disorders.
Okay. Thank you. And what do you think, what do you give as a solution to the general problem, including the healthcare system, communication, and everything? What do you think is a solution or are solutions?
About healthcare system, yeah?
About everything you gave out.
That's not easy to give an so
Okay, thank you. It was a great presentation, though. Thank you. I enjoyed it. Yeah.
I have one question too, may I ask?
Yeah, of course.
Do you hear me?
Yeah.
What hygienic measures can everyone take to prevent cancer morbidity? I mean, preventive measures.
Oh, I don't hear you. Can you maybe in microphone see?
What hygienic measures?
Slightly louder.
What hygienic measures can everyone take to prevent cancer morbidity? I mean, preventive measures.
Oh, I don't hear you. So
Use your microphone more close. Can you make it closer to you, to your mouth? Where is the microphone? And do this together with microphone.
And do you hear me?
Yeah.
Okay. What hygienic measures can everyone take to prevent cancer morbidity? I mean preventive measures.
I think that's of course sport. That's of course we need to increase our level of life. So that's sport. Do not to eat junk food and so on, so on. So.
Okay, thank you. Nice to hear your answer.